Swastyastu. So, hello everyone. So, we're from SGD, and in this opportunity, we would like to present to you about the importance of communication in palliative care. Before we start, we would like to present our gratitude to God for the blessings to us so that we can finish our student project. And also, we would like to present our gratitude to our facilitator, Dr. Dewa Ayu Agus Laksemi, M.Sc, for assisting us to in finishing this student project, and also our evaluator, Dr. Ayu Kusuma Wardani, Sp.KJ Mars, for evaluating our student project. Okay, so let's start. So this is the members of SGDB3. Me myself is Amadeus Fernandito Lepsana with the trainers digit number 115, and I will start the presentation with the introductions. So, chapter one, introductions. We will start with the background. So, palliative care itself refers to the interdisciplinary therapies that aim to improve the quality of life for patients and their families by reducing their pain and other symptoms brought on by advanced disease. And as palliative care requires direct interactions between patients and caregivers, communication becomes one of the most influencing keys to a successful care practice. Effectiveness in communications determines the ability of care practitioners to connect with the patients and the people who are important to them, comprehend their priorities and wants, and also assist them in making decisions about their treatment. But remember, the communication itself can never be neutral because it's either stress relieving or stress inducing. And nowadays, the deliveries of palliative care are often accompanied with several issues and challenges. And overcoming those issues and challenges becomes a mandatory task for clinicians to work on, as well as devising numerous of strategies in order to deal with several certain problems. So, the problem formulations of the student project. First, what are the definition of communication and palliative care? What is the role of communication in palliative care? What are the benefits of good communications? What are the approaches to palliative care communications? What are the challenges of palliative care communications? And also, what are the educations that can be given in palliative care communications? And the objectives is to know all about the problems formulated before, and also the benefits of writing this paper for medical students and for the community is to enhance the understanding and knowledge about the definitions, roles, benefits, approaches, challenges, and educations in palliative care communications. So that's all from me. Next one will be presented by my friend.
My name is Suni Chandra with the last three digits of student number 027. Today I'm going to talk about the definitions of the communication in palliative care. Palliative care emphasizes the patient as a biographical and autonomous being in addition to the life-threatening illness. Palliative care is not only available to those who are terminally ill as is frequently believed, but to all patients with active, progressing, and life-threatening diseases as well. Its objectives are to enhance life quality, manage symptoms, and stop physical, psychosocial, and spiritual suffering. Due to the intersubjective link that permeates interactions between team members, patients, and families, communication is a vital tool in the delivery of health services, including in palliative care. It is divided into verbal and nonverbal communications. Verbal communications is characterized by the thoughts and emotions that are expressed via the use of words to aid in understanding, while nonverbal communications includes body language, such as the use of gestures, glances, facial expressions, and even silence to communicate meaning. Both are complementary to one another and enable the identifications of the explicit and implicit contents that a person intends to address. Effective communications can assist them in making well informed decisions regarding their care and help us understand what their wishes are. Each patient has unique communication needs, which may evolve over the course of their disease. There are several things that can be done with each patient to facilitate communications, such as learning about the patients and their family, creating a comfortable environment for the patients, providing informations, and being mindful of your language and communication abilities.
Hello, my name is Nicotina Maharani with student number 220. So I'll explain about the role of communication in palliative care. Communication has an important role in palliative care, such as to build a relationship between healthcare patient and also family. So it can help manage the symptoms effectively and appropriately, and also can help for to plan further care. Another role of communication is to help exchange information between healthcare, patient, and also family. And the last one is to respond emotion, such as psychosocial and spiritual support for patient and also families. That's all about the role of communication in palliative care.
My name is Dewa with credit number 104, and I will continue the presentation. So, skill communication between palliative care providers with their patient and their family is important for their quality of life and has a negative impact when lacking. Palliative care communication can influence the decision making of patients for their treatment. Recent studies show that palliative communication is associated with less aggressive medical treatment, and also recent systemic review also found evidence of positive impact of patient well-being in the form of reduced hospitalization time, increased use of hospice and palliative care, and better compliance with the patient visit.
Hello, my name is Bagus Sutra Renugraha, which the last three-digit number is 219. And I'll explain about the importance of good communication in palliative care. So the communication is very important and crucial in health service, especially palliative care. A good communication defined as the process of information exchange, which also include feelings and a good understanding of the listener. Communication is the heart of palliative care because it helps to connect with patients, which is used to help patients in accept bad news, control emotion due to life-threatening illness, understand and remember loads of information, understand the prognosis of the disease, cope with uncertain expectation, build trust for long-term sustainability treatment, make decision for the treatment, and receiving outcomes from health promotion. Okay, that's all from me. Thank you.
Hello, my name is Almanda Chandra with last three-digit student ID number 086, and today I will explain about the importance of good communication in palliative care. So communication is a way of conveying information about the patient medical plans and their feedback in the form of their concern regarding the illness. So here in palliative care, communication is complex because each patient has different communication needs and may change depending on their disease. So here are some factors that can affect the communication process, such as the environment of the place, such as noise, not private. The second one is physical conditions such as hearing loss, cardiovascular disease, neurological impairment. And the third one is patient's emotion and mental conditions such as anxiety and depression. And the last one is the patient's ability to understand the language that is being used. I think that's all from me. The next one will be continued by my friends. Thank you.
Hello, my name is Sandy Aprilio with the three last digit of student number is 034. I am going to present the continuation of the importance of good communication in palliative care. Several things that can be done to achieve a good communication are: first, get to know the patient and patient's closest person. This can be done by take some time to know how the patients like to communicate. Establish relationship with people who are close to them, such as family members, friends, and caregivers. Find out what patients already know and encourage them. Second, make patients feel comfortable. For example, we can make patients that have memory problems comfortable by introducing ourselves every time we meet them. If possible, whenever we meet patients, the discussion must take place in a private place that is quiet, calm, and undisturbed. Ensure that the time of discussion is convenient, so the patients can rest if they are tired. Next, share stories with patients. Share stories and information in a way that patients can understand. Ask patients to tell stories about them and share information about what they know. Provide information in written form that allows patients to occupy their free time and have support when you are not there. Last, use effective language and communication skills. Ask an open question like how are you feeling and avoid closed questions like are you feeling better? Pay attention to nonverbal communication such as good eye contact and an open posture with open hands and feet, not crossed. Use simple language and avoid medical terms and non-standard language. Actively listen to what patients say. Make sure you understand what they are saying and be honest when you don't. That is all from me. Thank you. Next.
Hello everyone, my name is Madhu Peswari with the last 3-digit student number is 118. I would like to continue the presentation about communication and cognitive difficulties. Challenges in palliative care also include communication and cognitive difficulties. Good communication will develop better understanding about the diagnosis and future plan of the treatment. So the patient and family know what is going on, what is the major concern, and what is best for the patients. Communication is related to intellectual ability. Intellectual ability is a cognitive process when people can understand and remember things and be able to solve problems. Communication and cognitive skills are key components for palliative care patients to receive good information from healthcare professionals as well as giving feedback to the physicians. Talking about the communication and cognitive difficulties, each palliative care patient possibly have different capacity and capability to receive information. Moreover, they have limited communication skills. Some of the patients may also have intellectual and developmental disability, which may harden the communication between physicians and patients. Patients sometimes have problems identifying and understanding basic concepts of their illness, disability, death, and outcomes from the treatments. Moreover, it is hard for them to convey health complaints to the physicians. Caregivers may also use complex wording when delivering information, which is difficult to understand by the patients as well as the family. These conditions may cause problems achieving palliative care goals. To be able to go back on track with palliative care plans, health caregivers have to overcome communication boundaries by initiating a person-centered approach. This approach is done by showing empathy to the patients, not in a hurry building relationship, letting the patients express themselves, involving family members, and using certain tools for people with communication problems and disabilities. That's all from me. Thank you.
Good morning, afternoon, doctor. My name is Felix with last digit of student ID 099. I've got a presentation regarding cultural differences. So, culture can be defined as a complex knowledge regarding rules, way of life, ritual, habits, attitudes, and belief, which are compiled, shared, expressed by a particular group with the same background. So, there are many types of cultures in the world. However, they all have the same general processes. First is the purpose of connecting people. Second is giving them identity, and third is establishing frame of communication. So communication and culture have a complicated direct relationship to each other. First, culture are initially initiated by communication between individuals, and second, culture are maintained passed down between generations through communication. And communication practice are heavily influenced by cultures. So in palliative care, cultural aspect have a general impact to our patient. First is the patient preference for care. Second is the communication style, and third is the meaning of suffering, and the last is decision-making process. So next.
All right, everyone. Hello, my name is Sp.KJ with the last 3-digit number of 103. And now I'm going to continue our team's presentations about our student project. And I will tell about the education in palliative care communication. As the importance of palliative care has become increasingly recognized, so too does educations of palliative care become increasingly demanded. As such, it is vital for education in palliative care communications to succeed, which may require several things, such as education tools, for example, resource website, which may be used to share educational resources required to adequately teach about palliative care and palliative care communication. And then there are training programs, which can be used to train medical personnel or medical students about palliative care and the importance of palliative care communications. The training programs used may be different depending on the university or hospital that use the training program. And then, last but not least, is standardized curriculum, which is required for more structured and systematic teaching or education of palliative care, which includes palliative care communications. The curriculum used may be different for undergraduate and postgraduate students, may be adjusted accordingly. That's all from me. Thank you.
Hello, my name is Angelia Ephraim Horas with the last digit number 055. So today I will continue this student project presentation by explaining about the simulation in education palliative care. So after 20 years where technology has developed, palliative care play an important role in medical education, especially in simulation. To improve patient safety and clinical competence, simulation-based medical education is needed. One of the methods is the sociodramatic. The sociodramatic is the method that refers to reading body language and patient interaction. This method is applied by means of role play, which is play alternately in order to understand the patient feelings. Another method that was found was the virtual patient. In this method, students will observe cancer patients with bone metastasis that have been more than 6 months old. Students will try to improve patient comfort in the end of life. In addition to improving communication skill to patient, palliative care simulation were also developed to educate communication skill between health profession students as a team. Therefore, it's necessary to have a good communication as well. Communication skill can be improved by practicing. Health profession students can practice through simulation by demonstrating a scenario about palliative patients. By practicing a lot of scenarios, students will be helped to face the real situation in the future. Maybe that's all for me. This presentation will continue by my friends. Thank you.
Hi, my name is Aurelia Sepaniantanto with 3 last student number 137. Now I will explain about the conclusion of our student project and the feedback. The conclusion of our student project are good communication is needed in palliative care. The benefit of good communication in palliative care are assist in making decisions regarding patient care, understand patient wish, provide psychosocial and spiritual support for the patient and their families. Good communication also associated with clear thinking, feeling informed, cultivating trust and comfort from the patient. Good communication also associated with less aggressive medical intervention, and it can also reduce hospitalization time. Several things that can affect communication process are places, patient physical condition, patient mental condition, patient ability to understand and use the language, culture, and cognitive difficulties. Communication education in palliative care are very important. It can be provided through training program, centralized curriculum, and educational tools. Our feedback is we need to improve communication education in palliative care, and also students that learn palliative care need to practice their communication from various scenarios so they can face the real situation in the future. This is our bibliography. That's all for our student project. Thank you.